Hi, my name is Kristen Rodriguez, and my partner's name is Jacqueline Tabasio, and we watched the first video. The first question I'll answer is the errors throughout the video. So the first issue was the unlicensed professional reports to the nurse that the patient is itching. And at that point in time, the nurse, rather than saying, go get some Benadryl, or tell them to go to the LPN and get some Benadryl, they should have gone to assess. That's an assignment that can't be passed off to an unlicensed professional. Only nurses can assess. Secondly, the med administration by the LPN was passed off to the unlicensed professional. She just told her to go give her some Benadryl. She's just having an allergic reaction to the dye. Well, you can't, an unlicensed professional cannot pass meds. And part of the issue is that, according to Northeastern University, the major issue with medication errors is the workload that nurses have. And throughout this video, you noticed both the nurse, the RN, and the LPN were both very busy and just had too much work. And that's what truly caused the issue, them in not doing what they were supposed to do. Next, we have the unlicensed professional didn't ask the patient if she had any allergies. That's one of the critical elements you should do whenever you greet a patient, especially if you're going to be handing them meds. So obviously, that could have prevented if she had said, "Are you allergic to anything?" and she said Benadryl. There are other options too that they could have searched out, and instead of Benadryl, like cetirizine, which is another antihistamine. The unlicensed professional didn't perform the 6 rites because she's not a nurse and she didn't do it. So to elaborate on that, the 6 rites could have had created a positive outcome, because if the 6 rites were performed, you would have noted that it not only was the wrong patient, but it was also the wrong medication. And by knowing that that patient's allergic to Benadryl, you would have known not to give that patient the Benadryl. Next, we have, and like I said, they could have, knowing that the patient's allergic to Benadryl, they could have searched out a different antihistamine that would have helped with the allergic reaction, like the cetirizine. How does the medication error impact the nurse, client, family, and the organization? So this is a sentinel event, which means that the patient died. So obviously that's a huge impact on the patient themselves. They're no longer going to be go on living, and whatever support they gave to others, whether it be their children or their spouse or maybe an older relative, they're no longer able to perform those. The nurse will be disciplined by the state board. They could lose their license, they could lose their job, they're going to obviously have mental anguish because of the fact that they are the reason that they caused this death. And there could even be potential charges brought before them in a court of law. Obviously, the unlicensed professional also is going to be dealing with the mental anguish. And then the family will, like I said, they're going to have a tremendous amount of grief and mental anguish, and whatever support that patient was to them, they no longer have that support system, whether it be just driving somebody to and from school, or making dinner, or getting the kids up in the morning. Who knows? It could be so many things that could be a concern. Have you or a family member experienced a medical error or a near missed error? So I did experience this. It was actually my husband during his chemo regimen. So due to improper documentation during the 5th cycle, they didn't note properly that he had developed an allergy to the oxaliplatin in his FOLFOX regimen. And during the 6th cycle, they attempted to give him the oxaliplatin again. So they had not noted that it was an allergy properly. And when they gave it to him, almost instantaneously, he went into anaphylactic shock. And the nurse had to rush in. They had to give him multiple liters of fluid to flush the system, Benadryl. And now every time we go anywhere, he automatically gets his allergy bracelet. But he could have lost his life that day. Luckily, since it was in the infusion center, there were a lot of nurses and staff nearby, and they were able to counteract the measures promptly. But it's always very important to document what occurs in these infusions and these treatments with the medication. Properly go back and check lab values and vitals just to make sure that the patient is safe. Okay, so again, that was Kristen Rodriguez and Jacqueline Tabasio. Thank you.